Welcome to Vernon Jubilee Hospital Pre-Operative Class 2 for hip and knee replacements. You should be watching this class once you have received a date for your surgery. COVID-19. You are going to be screened for COVID-19 symptoms by the patient navigator at the doorway and by the nurse on the day of surgery. Please do alert us if you become symptomatic or test positive for COVID-19. We do allow visitors in if they have proof of vaccination, two vaccines, to visit during the hospital. And at this time, we do request that everybody in the hospital wears a mask. Please let us know if you are feeling unwell or have symptoms of a cold or any stomach upset. Who is your support person at home? Your support person is a family member, friend, neighbor, or private caregiver. You will be required to have assistance when you go home for 72 hours, day and night, after your joint replacement surgery. Ideally, you should arrange for help for longer. Your support person is the person who drives you home once you're discharged from the hospital and to your follow-up appointments with your surgeon and the physiotherapist. They should be able to assist you with meals, going up and down the stairs, bathing, or changing bandages as necessary. More importantly, they are the person who is there if an emergency should arise. Vitamins. Please stay on your baby aspirin unless you are otherwise directed by a doctor. Up to the day prior to surgery, you may continue taking your vitamin C, vitamin D, magnesium, calcium, iron, and lutein. All other herbal vitamins and supplements must stop 7 days in advance of surgery, especially things like garlic, omega 3, fish oils, chondroitin, and glucosamine, as these can increase your risk of bleeding. Hygiene. Please have a shower or bath the night before your surgery, as well as the morning of your surgery. Please pay special attention to wash between your toes and use a fresh towel to dry both times. Please note that Vernon Jubilee Hospital is a scent-free facility. We do not allow any products like colognes or aftershaves or perfumes or lotions with scent to be used. You are allowed to use deodorant, and please ensure that your visitors do not wear any scented products or fragrances as well. Skin breakdown. If you develop any sores or open areas or wounds or rashes near your surgical area, whether it's your hip or your knee, please let the surgical optimization nurse know, and we can help notify your surgeon. Your surgical date may need to be moved due to the risk of infection if you have a wound near where we will be operating. On that same note, do not shave your legs for 1 week before surgery. We don't want any cuts or microabrasions to your skin, so we ask that you come in nice and hairy for us so we can clip the hair off your legs. What time is your surgery? You will receive a phone call from the patient registration clerk between 12 and 2 the day before your surgery. If your surgery is on a Monday, it will be the last working day prior to your surgery. For example, on Monday, for a Monday surgery, you'll likely get your call on Friday. And just be aware that that date could differ if there's a statutory holiday near your surgery. Fasting and preparation for surgery. We ask that after midnight, the night before your surgery, no solid foods. You can eat a light dinner. In the morning of your surgery, you may brush your teeth. Do not eat any solid food. You may not smoke tobacco, cannabis, or recreational drugs the morning of your surgery. You may drink water or clear store-bought apple juice or Gatorade between midnight and when you are told to stop by the clerk. Only the medications that have been instructed to you by the doctor or the nurse you should take. If you have any questions, please call the surgical optimization nurse. When hospital staff phone you, please have a pen and paper handy so that you can write down any instructions that you are given. Things to pack for your hospital stay. Please make sure that you pack comfortable clothes that allow for swelling. We want to ensure that you have non-slip supportive footwear that will also allow for swelling. Expect some swelling in your feet. We want you to bring in your crutches, whether that's from the Red Cross or home, to ensure that they are the correct size for you. Bring any toiletries that you may need for your stay in the hospital, such as a brush, toothbrush, toothpaste, deodorant, or any face cream. If you do use a CPAP, please bring in the machine when you come for surgery. We will be using it here in the hospital. We will also have an anesthesia assistant look it over to ensure that it's in good working order. You are allowed to use a cell phone here in the hospital. Please remember to bring your charger. Your family may call you and you may use your cell phone once here in the hospital. You should bring a little bit of money if you can, $20 or less, no valuables. The hospital will be supplying most medications. Things we don't provide are often things like eye drops, nasal sprays, inhalers or puffers, and some cancer medications. If you're not sure, you can check with the patient navigator or the surgical optimization nurse. Those numbers will be at the end of this lecture. Please bring any dentures or glasses or hearing aids, including cases. Leave all of your jewelry at home. Interior Health is not responsible for any lost or stolen belongings. Common reasons why surgeries can be postponed would be things like a urinary tract infection, if you've had a dental infection, open wounds or skin infections, if you don't have anybody to help you after surgery, major health changes that would affect your anesthetic, and sometimes steroid injections. We want to ensure that you have not had a steroid injection into the joint you're having replaced for at least 6 weeks. Dr. Dooley requests 3 months from your surgical date. Unfortunately, here at the hospital, emergencies do arise that are outside of our control. So there is a chance that your surgery may be postponed at any time up to and including the day of your surgery. Rebooking your surgery happens as soon as possible. You do not lose your place on the wait list, but your surgery will not occur the following day. On the day of surgery, you should arrive to the hospital at the time specified on the phone call the day prior. Please bring any personal items and the crutches into the hospital with you. You will need to stop at an admitting desk to check in. The admitting desk may be on the second floor of the Polson Tower or at the emergency department, depending on your arrival time. We will tell you where to go. Once you have been admitted, you will then proceed to the third floor, where you will check in again. A nurse will call your name in the waiting room to check you in, review your health, review dates and times of the medications you took, check your vital signs, and label your belongings. The anesthetist will speak to you in the pre-op holding room to review the plan for your anesthetic. The surgeon will confirm with you what surgery you're having done and initial or mark your leg. The operating room nurse will take you to the operating room. The surgery will take approximately 1.5 hours. After surgery, you will go into the recovery room for another hour to hour and a half. You can connect with your family right away if you bring your cell phone. Your family can expect for you to be away from them for approximately 3 to 4 hours. Discharge planning usually happens same day or the day following surgery, which we call day 0 being the day of surgery and day 1 the day after surgery. It is possible that you could go home about 6 to 8 hours after surgery and for sure the next day by 10 a.m. Please ensure that you have a support person in place to pick you up and to help pick up your prescriptions. You need to have somebody to stay with you for at least 72 hours, 3 days and nights around the clock. Whether you stay in the hospital one night or you go home, you will need some help. You will need to have help with rides until you are cleared to drive again after surgery, which can be as long as 6 to 8 weeks, depending on your recovery. Bring a black plastic garbage bag to the hospital. This can be placed on the seat of the vehicle you're traveling in to help you turn into the vehicle easier. We will arrange for you to have necessary equipment such as crutches and a walker from Red Cross. We do need some information about your home environment to ensure we have the correct equipment for you. So please watch your email. Think about where you will be recovering after surgery. You want to have easy access to a bedroom, bathroom, and kitchen. Your dressing is left on for 7 days, and you may need help changing this dressing from your support person. We will give you a handout. Postoperative delirium. This can be decreased by alerting the nurse if you have a history of postoperative delirium. As we understand the brain more, we are able to predict certain criteria that predisposes patients to have postoperative delirium or confusion. There are important things we can do to prevent or decrease your chance of having confusion issues after surgery. Wear your glasses and hearing aids into the operating room and put them on as soon as possible after surgery. Have earplugs if it's too noisy, or you may bring your own. Mobilize as soon as possible. Limit alcohol prior to admission, and try to prevent constipation and infection. Once you are home from the hospital, take your pain medications before you do your exercises. Do your exercises at least 3 times a day. Try to spread the exercises out throughout the day and ensure you're balancing activity and rest. Remember, exercise is a lifetime commitment. Elevate your leg to decrease swelling. Use ice packs or a cryo cuff to help control the swelling. Do not sit for more than 30 minutes at a time with your feet down. Change your position. If you cannot sleep, get up and move around. Do some exercises. Try some ice and elevation. Take pain medications regularly, even through the night. Try sleeping on your side with pillows between your legs and behind your back. Ask your support person for help repositioning. Pain. You should expect to have some pain after surgery, and this is normal. Try to keep your pain at a level that you can still get up and move around. Most people are comfortable around a level 4 out of 10 on the pain scale. Try to stay on top of your pain control by taking medications regularly for the first few days. When the pain levels creep up, keep in mind that surgical pain will improve over time, whereas the arthritic pain can get worse as it progresses. This pain is temporary, and your pain will likely improve over time. Take the medications as prescribed by your surgeon. This is usually a combination of acetaminophen, also known as Tylenol, as well as taking anti-inflammatories and short-acting narcotics. If your surgeon allows, you may use ice 10 minutes out of every hour. The narcotic is to be used as needed, and you may find you'll stay on the Tylenol and NSAIDs until your pain is better controlled. Pain medications. It may help to think about taking pain medications in layers. The first layer of pain control is Tylenol or acetaminophen. Aim to take around 4,000 milligrams in 24 hours. This is usually 1,000 milligrams of extra strength Tylenol every 6 hours. This is processed by your liver. You should check with your family doctor if you should or should not take Tylenol. The next layer of pain control are nonsteroidal anti-inflammatory drugs, or NSAIDs. These work in a different way than Tylenol and can be taken together for really well-rounded pain control. Do not take more than one NSAID at a time. For example, do not take ibuprofen and Celebrex together. These medications are processed by your kidneys, and you may have trouble if you take too many. If you have had any bleeding in your bowels or any kidney problems, your doctor may not want you taking these medications. The final layer of pain control is using narcotics as needed. Your surgeon will give you a prescription for narcotics to take every 3 to 4 hours. Your surgeon may choose a narcotic called tramadol, and that comes in 50 milligrams tablets. Tramadol is a combination of tramadol, 37.5 milligrams, and Tylenol, 325. Your surgeon may also give you Tylenol 3s. They won't likely give you all 3 of these. There will likely be one of these that you're taking. It's important to know what's in the medication that you're taking so that you don't take too much Tylenol. Check with your pharmacist when you are filling your prescription to ensure that you know what's in the medication that you are taking. Together, taking all three layers can provide well-rounded pain control. Typically, you're given a prescription that will last between 7 to 10 days. The first couple of days, we expect that you'll use the narcotic fairly regularly to maintain good pain control and be able to complete the exercises and mobilizing. You may find it helpful to set alarms and write down what you take so that if your pain increases suddenly, you know what medication is available for you to take next. Towards the end of your prescription or when your pain is starting to improve, you may start to wean off the narcotic and just use it at night. Typically, most people find the pain a bit worse at night, so you can take the narcotic then. You should have made an appointment with your family doctor once you find out about your surgical date for about 1 week after surgery. You can talk to your family doctor about renewing your pain prescription if you need more pain control. Sorry. As far as managing pain, other things that you can do are exercises. You think that exercises can make the pain worse, but moving the joint actually can help with the pain. Try to keep yourself distracted and relaxed. Tense muscles tend to increase the pain, so try to keep yourself distracted and relaxed when you're going through an increase or surge in your pain. You can use ice or a cryo cuff 10 to 15 minutes an hour and rotate their location on the leg. Make sure that you are getting your leg higher than your heart. So a lot of times people are elevating their leg in a recliner, but that bend at the hip can really impede the flow of the swollen limb. So what we want you to do is to try laying on a couch or a bed to try to get that leg up higher than your heart on a gentle incline so that that swelling can come out of your foot and knee and decrease. Sometimes you can have nausea at home after surgery, and it can be related to the anesthetic, the pain medication, medication reactions, or constipation. So once you're home, advance your diet once the nausea subsides. Once, if you do experience any nausea, you can try sipping on ginger ale. Peppermint tea or smelling peppermint can sometimes help with your nausea. If you are vomiting, you may want to try some gravel pills or suppositories. And if you haven't had a bowel movement in a couple of days, make sure you've taken some laxatives to ensure your bowels are moving. If you remain nauseated for a while, you may want to have some Boost or Ensure to help with your nutrition. Managing constipation. Make sure that you are taking enough water in the day, making sure that you're getting those high fiber fruits and vegetables and prunes in your diet, and ensure that you have been monitoring when your bowel movements are occurring. If you haven't had a bowel movement and it's been a couple of days, we want to make sure that you are doing something about it sooner than later. There are lots of medications that are available over the counter, and polyethylene glycol, or PEG, or Restorelax, or Miralax is a really great preventative to start on right away after surgery, and hopefully you won't need any further laxatives. If you do, you can try some Senecot or Bisacodyl, and hopefully you won't need to take anything stronger. Do check with the pharmacist. Watch out for signs and symptoms of infection. These are covered in the booklet that you will receive on the day of surgery. Things that you're looking for are things like redness, swelling, drainage, heat, a foul odor coming from the wound, a fever, or just a general feeling of being unwell, a racing heart, sweating, sweats that come and go, achy body, or chills. If you are worried about an infection, do not leave it. Please contact your surgeon or family doctor, visit urgent care or the emergency department. As far as dental care goes, dental infections should be treated immediately as the infection can spread to your new joint. We do recommend that you wait 3 months before having any major dental work or any cleanings. Make sure that you do let your dentist know you've had a joint replacement. Sometimes some dentists do provide antibiotic prophylaxis before your cleanings and dental work. As the guidelines are changing, it is important that you always keep your dentist up to date of what you have had done. A physiotherapist will be giving you a call within a week of discharge. They usually call around day 7, so expect a phone call. They will try to make an appointment for you at the Vernon Hospital around the 2-week mark. So after surgery, you should be coming in for a physiotherapy appointment around 2 weeks after surgery. If you've had your knee done, the goal is to be 90 degrees by the 2 weeks after surgery. If you're having any issues with getting that bend, it's important to work on those bending exercises, and you can give the hip and knee navigator a call. If you are from out of town, the outpatient appointments can be set up in your hometown. The physiotherapist will ask you what your discharge plans are when you see them here in the hospital, and you just let them know which community you'll be going to after surgery. Post-op surgeon appointments. At about 10 days to 14 days after surgery, your surgeon will want to see you at the ortho clinic for a staple removal and a wound check, and to ensure that you're able to move very well after surgery. And then after that, there will be a 6-week visit, typically in their office, and then at 3 months after your joint replacement or as needed. When can you drive? You can discuss this with your surgeon at your 2-week follow-up appointment. It depends on how you're recovering, which leg you've had operated on, and if you're still taking narcotics, then you should not be driving. If you are not allowed to drive, you should think about some options to get to and from appointments, and to get supplies or groceries. Options include handy dart, taxi, bus, friends, family, or a support person. And when you can fly, you'll need to check with your surgeon and your insurance before you fly. Who to call for help? 911 is in case of an emergency. So things like if you're having chest pain, chest pressure, or shortness of breath, or if you've had a fall. 811 is a health link where you can talk to nurses 24/7. You can call 711 if you're hard of hearing to get to the same line. 811, you can talk to nurses and pharmacists and lots of really great resources available for you to talk to. If it's something that can wait a little bit longer, there's the hip and knee navigator. We work Monday to Friday, no statutory holidays, and you can call and leave a message at 250-558-2109. You can also talk to your pharmacist if you're having issues with your pain medications or bowel care. You can also talk to the surgeon's office. What to do. If you need a refill of pain medication, you can call your family doctor, you can visit urgent care, and you can go to a walk-in clinic. If you're experiencing a pain crisis, you can come into the emergency room. If you are experiencing chest pain or pressure or shortness of breath, you need to call 911 or have your support person call 911 and go to the nearest hospital. If you are experiencing pain in your calf that's worse when you're standing or walking, you need to go to the nearest hospital to get checked for a blood clot in your calf. If your wound opens, you need to go to the nearest hospital. Thank you for taking the time to watch our presentation. If you have any questions or concerns, please write them down so they can be addressed when the nurse calls you. You can update the surgical optimization nurse if your health status has changed by calling 250-558-1311. And you can also contact the hip and knee navigator at 250-558-2109 with any questions about your surgery. Thank you.